Uhuru.
Uhuru.
I want to welcome you, Sister Mary, to the Uhuru News Telethon.
Yeah.
And for all those who are with us today,
Mm-hmm.
I'd like to introduce my guest.
Yeah.
That is Nurse Midwife Mary Karoma, who has traveled to the United States from Sierra Leone to participate in a U.S. wide fundraising tour for the APDEP Infant and Maternal Health Project that Sister Mary will be leading. So, thank you very much for sharing some of your time with us today to talk a little bit about infant and maternal health in Sierra Leone and about the work that you'll be doing as a part of the APDEP Infant and Maternal Health Project. So, thank you,
Yeah.
Sister Mary, for being
You're
with us
welcome.
today.
Welcome. Yes. Yeah.
So, if you could just tell our viewers a little bit about you, who you are, and some of your professional background.
Um, my name is Nosmiri Koroma. I'm a trained midwife. Attended the School of Midwifery in Sierra Leone, Moyamba district, and for complete 3 years, I worked for the Sierra Leone government and maternity hospitals for 4 years, and I resigned from the government because of reasons. I was not paid, and even those who were been approved uh, were not paid in time. So I resigned from the government because of so many reasons. Example like poor medical facilities, maternity hospitals were poorly equipped, inadequate medical facilities, even poor standard of living. So that makes me to resign. But because of, as a midwife, I have the love for my country in order to reduce the maternal and infant mortality in Sierra Leone. So I still thought it fit that it's my place, it's a pledge to me in order to help reduce the infant and maternal mortality in Sierra Leone. So that's the reason why I intervene in order to work with traditional birth attendants so that we'll be able to safeguard the lives of pregnant women and children in Sierra Leone.
Excellent.
Yeah.
Could you tell us a little bit more about what some of the conditions are like in Sierra Leone in general, and also in the medical facilities that exist in the country?
Uh, actually, Sierra Leone has the highest maternal and mortality rate in Sierra Leone, and is counted one of uh, the 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 countries that is underdeveloped as far as the whole world is concerned. So we have the highest percentage rate on maternal reduction. I mean on pregnant women and children who died at least almost every day because of lack of poor medical facility, poor standard of living, inadequate medical supplies, and this is the reason why the the government, even the whole world, is focusing their attention to Sierra Leone in terms of the death rate, the high death rate in Sierra Leone, because it's very alarming in our country, Sierra Leone.
So when we think about Sierra Leone, some of us, we may think about diamonds. There have been some movies talking about
Yeah.
the kinds of diamonds that people have, taken from the soil of Sierra Leone. And there's gold, there's rutile, there are, all kinds of minerals and, resources that should provide a high standard of living for Africans in Sierra Leone and Africans around the world. Yet statistically, Sierra Leone is seen as one of the least developed, as you mentioned.
Yeah.
One of the places where the people have the lowest standard of living,
Yeah.
one of the shortest life expectancies, highest rates of infant and maternal mortality, which we know is a consequence of the fact that the masses of African people in Sierra Leone, as we are around the world, don't have access to our resources. We don't have a government that works in our interest, and we don't, in essence, have self-determination. Yet there are efforts, like the efforts that you've been leading in Sierra Leone, to organize everyday people. You know, in the case that you were talking about, women who serve as traditional birth attendants, who are trying to stand in the gap to fill the needs of the people, and the women in particular, pregnant women in Sierra Leone and babies. So could you say something to us about the traditional birth attendants in Sierra Leone and why it's important to pay attention to what role they play in reducing infant and maternal mortality?
Traditional birth attendants play a big role within the Sierra Leone community. They complement the effort of the government in helping pregnant women and children. So this is the reason why they are in better place in order to help in the way to be well equipped with appropriate training, so that they will know their limitations in pregnancy. And traditional birth attendants are better placed in the way so that they will be able to even teach women in the communities, especially women of childbearing age, so that they will be able, in fact, to improve their health in terms of health education. To the pregnant women, they will know what is affecting their status in pregnancy, and they too will be able to know their limitation in pregnancy, so that they will be able to refer cases that are beyond their scope to the bigger centers. So traditional birth attendants are people who really complement the efforts of the medical staffs, because the pregnant women and children wholly and solely pay attention to these traditional birth attendants because of the poor medical facilities in the country. And even when you go back to the interior part of the country, under 5 clinics are very few and non-existent. So all these problems are the reason why people pay attention to these pregnant, to the traditional birth attendants in the way, so that they'll be able to help mothers and babies in the community. So there is we see that they are better placed in order to be educated and to give them appropriate delivery methods, so that they'll be able to help the pregnant women in the communities.
The medical facilities that are in Sierra Leone, you've spoken about the fact that many of them are poorly equipped. You know, many of the staff may not have, even in some instances, the kind of training necessary, the kind of equipment, medicines that are needed. Are there other issues? What about electricity, clean water? Are those a problem for the medical facilities?
For so many years, proper mechanism has not been put in place in order to put all these things in place, especially water supply, the light facilities. Even these are the main factors that contributed to the death of even the children, because if some are born if they are underdeveloped, so if they send them to incubation units, there is no availability of light, so the children will die. In fact, in terms of oxygen, if the women are being referred on obstetric cases, so if they have been undergoing a cesarean section, and light will suddenly go, so at the end of the day they will not be able to even make it up in terms of oxygen supply. So these are all the factors that are responsible for the death in Sierra Leone. So even in terms of hygiene, to the in terms of food, good food supply, poor standard of living. All these things are problems that the people are facing in Sierra Leone.